Hey guys, Dr. Cody back here again. Hope you enjoyed that explainer video going over low back pain and some of the causes and most common ones that we see in the clinic. So to answer that question that we had, what's the most common thing that we see that's causing low back pain? Facet joints, right? That's the number one thing that we see here in this office that's creating that low back pain. And again, it's because of, we talked about last time, that outer layer bone has a lot of pain fibers. These facet joints tend to get loaded. A lot of us have weak cores, we have overly tight backs, right? So we have a lot of compression going on in our back, and it's this back area that gets compressed, this facet joint, which causes a lot of that pain. Now, all of these conditions we see in the clinic on a regular basis, and so each one has a kind of unique way that we like to treat it and some kind of overlapping treatments that we do. In general, the first we want to assess for is joint dysfunction. Obviously, we're a chiropractor. We want to make sure that the joints are moving the way they need to move. So we always check for joint mobility and any restrictions that may be in there, and we adjust. What's really cool is that we can kind of tackle the disc and the facet and the muscle with the adjustment. Obviously, with the disc, when we adjust, we actually increase the space between the joints. So we lower pressure. So it's a great way to reduce pressure in that area. And so the old myth that chiropractors are, blowing discs and herniating discs is actually false, because we don't increase pressure. We decrease pressure because we increase volume. So we have that inverse law that's going into effect. Second, with facets, if the facets are being compressed and when we adjust, the joints that we move are the facet joints, it makes sense that we need to get these joints moving again. And so we can adjust these joints to help reduce some of the pain that's in there. There's also something that's really cool. Inside of every joint, we have a ton of receptors, right? That are communicating information to our brain. One of them is what we call mechanoreceptor. That's receptors that are dealing with motion and movement. And another one is called a nociceptor. That's dealing with pain. And inside the spine, inside these joints, your motion receptors outweigh your pain receptors 3-to-1. So if we can really get these joints moving again, activating those motion receptors, we can reduce the pain signaling that's actually reaching the brain. So another way we can reduce pain and get better movement in here. And then with the muscle, when we adjust, we do something really cool called fast stretch. So that muscle gets stretched really quickly, not very far, but really quickly. It actually initiates this reflex where the signal goes to the brain. The brain thinks the muscle is going to stretch a lot further than it needs to and may get damaged. So it sends another signal back down to the muscle, telling it to relax. So the way that we reduce tension and spasms in a muscle when we adjust. So that's kind of the first avenue that we want to go to. When we're dealing with specifically with sciatica, if it's coming from this piriformis muscle, we call it piriformis syndrome, we want to do twofold. One, we want to reduce the tension that's in this muscle. We can do that a couple different ways, right? We could do myofascial release, or my personal favorite, dry needling. We can actually place needles into this muscle, connect it to our stim machine, and let it run a current to reduce the tension, also while increasing endorphin production and relaxation to this area. And then second, we want to train it with some exercises. My favorite exercise to do for the piriformis is one that's crudely called the fire hydrant, and you'll see why here in a second. So for this exercise, you can do at home. You're going to come onto the floor, or in this case, I'll be doing it on a table here, and you want to get into a good tabletop position. You want to make sure that we're engaging our core, not letting our belly drop down, but really feeling that tension build. And all we're going to do is we're going to lift a leg up to the side as high as we can go, and then back down. What I don't want to do is I don't want to twist and rotate. I want to try just to feel my leg lifting as high up to the side as I can go. And now you can see why this is called a fire hydrant. Yes, you can see that. So for stretching this muscle, right, sometimes we can do some home stretching as well. Right, we want to try to bring our knee to the opposite side of our shoulder, right? So I'm going right knee to left shoulder, and you'll be able to feel this deep glute muscle stretch through here. As every time when you're stretching, you want to hold this for at least 30 seconds, taking some nice big breaths in and all the way out. And what I like to do is kind of build rounds into my stretching. So I'll stretch, I'll hold it for about 30 seconds, come off for a little bit, and then come right back in and try to go a little further, and do about 3 rounds of that. You can also do a version of a pigeon or a figure 4. So you cross the leg over, make a 4, you're gonna reach through, grab this other leg, and lean back, pull back, right? So again, I'm stretching my right glute piriformis area through here. Feels pretty good. Same thing, about 3 sets, 30 seconds on those. And for the fire hydrants, 3 sets of 12 to 15. Great way to reduce tension while also building strength into this muscle. For discs, the best treatment that we can do here in the office is decompression, right? The table is specifically made to open up the space between the joints, decreasing pressure and allowing that disc to actually push back in. We've actually had documented cases of reducing disc herniations from 15 millimeters down to 7 millimeters in the office, which is pretty significant. So our decompression table, we can target a disc level based on the angle that we're going, and pull rate depending on how big the disc herniation actually is. And so we've had some amazing results with that through here. For exercises, typically discs respond better to extension-based movements at home, right? So we would call these McKenzie-based exercises. You can actually look them up online and find a bunch of them. But my favorite one to start with is actually one called the Sphinx pose. So patients can start here on the bottom, and what they're going to do is they're going to slowly push themselves up into an extended state and come back down. So I'm using my hands, my arms, my forearms as a tool, as assist to help get myself into this extended state, really engaging my low back muscles, right, and kind of working a pump through here. Okay. Something else you can do is called a reverse hyperextension. So if you have a bed, it works really well. If you're at the gym, you can actually use a workout bench as well. What you want to do is you want to lay down on the bed or the table. The goal here would be to get the hinge point of your hip right at the end of that bench or table. Reach out and hold. Keep your legs in a neutral position, and then you're going to lift them up, squeeze and hold, and come back down. So again, we're working this extension through the low back, which is going to help push that disc, because typically discs will herniate backwards. Helps to kind of push it back in. This feels really good, especially if you worked out after a heavy hinge day. So if you're doing a lot of deadlifts or squats, this can really help relieve tension in the back, as well as getting some good, healthy movement into that disc as well. So with these, you can do same thing, 3 sets, 12 to 15 on each of those to help reduce some pain and tension. For the facets, we talk about adjusting, right? That's kind of our number one thing because these joints aren't moving properly. We want to get them moving. But dry needling also works really, really well here because when we needle the low back, we actually target this facet joint and we place the needle directly on that. We can stimulate the nerves that are coming through here. Connecting it to our TENS machine will actually increase endorphin production in this area and release tension in the spine as well. So we can do some of that. For facets, right, we talk about that. Typically a facet is going to be having more of this like weak core, tight low back, so we're compressing. So we need to do more flexion-based exercises, what we call Williams-based exercises. And so my favorite 2 exercises to actually do for this is going to be one called a curl up and one called a dead bug. So we'll start with the curl up. This is kind of our beginner stage for it. You're going to lay face up. We're going to bend one knee. It does not matter which knee you bend. Whichever one feels more comfortable is where we want to be. Your hands, I like to take my hands in this kind of position here, and I'm going to slide them into my low back. Now, naturally, you're going to have a little bit of a space, right? Because we have this curve in our low back. So the exercise, the first part is trying to take that curve out. So I want to push my belly button through my spine into the table or floor. You can do this on the floor and really feel that back flatten out. This is stage 1, right? Just holding this pressure here for a couple seconds and then letting go, right? Really feel this inner core, this transverse abdominis engage and relax. Once you do that for a few times, kind of feel that muscle kind of work a little bit more, we're going to add the next step of the exercise, which is to lightly lift off the table. You can see the nice shaky shakes I got going. That means we're working those muscles really good. So we're going to squeeze down, flatten out, and lift slightly. If you notice, I'm not lifting up through here. I'm not doing a crunch. My neck isn't actually moving. I'm focusing on a point on the ceiling, and I'm just lifting my shoulders and upper back off the table. 3 sets of 12 to 15 on these as well. The next one, it's going to be a little bit more challenging to do, but I find it really good at taking that engagement and working this muscle, progressing it, and getting it even stronger than we did before. Dead bug. And again, you'll see why it's called that. We're going to lay on the floor or on this table here, hands directly in the air, knees directly in the air. We don't want our knees pulled back. We want them directly perpendicular to the floor. And again, you're naturally going to have this little arch in your back, but we have to take that out. So we're going to squeeze our belly button through the floor and really flatten that spine. Now, this would be step 1, right? Just holding this for a few seconds, deep breathing, then relaxing. But if you can progress it to the actual movement, that would be the next step. So from here, we're going to go opposite arm and leg, keeping the back flat as I reach and come back. Now, I see a lot of people do these moves completely wrong. They do this. right? They look like they're just flailing and kicking. This is doing absolutely nothing, right? Got to keep the core engaged, and you got to move really, really slow. Now, our goal would be to get an inch above the ground with both of these, but you're going to take it to your level. What we don't want is our back lifting up and off the ground while we're doing it. So keeping the back flat all the way through here. And this one I like to do, counting 3 sets of 20 to 30, trying to get 10 to 15 on each side. All right, and last is going to be muscle. This kind of incorporates everything, right? So depending if the muscle is shortened and tight, we can needle it to reduce tension. We can do decompression to actually pull and separate and stretch this. We can adjust the area to actually induce that fast stretch. And then we do these exercises, right? So the exact same exercise we just showed you here, we're all about trying to strengthen this spot. So give these moves a try. If you're confused on what may be going on, feel free to schedule an appointment here in the clinic. We can do an assessment, see exactly what's going on, and give you a thorough plan of attack to get you back living your best life. Hope you guys are having a great day. Look forward to seeing you soon.